Chicago and the surrounding suburbs have historically been segregated by race and class. This fact has not changed over time, despite the often heroic efforts of organizers and activists from the well-known to the unsung. The result, concentrated poverty in metropolitan Chicago and unacceptable health inequities. In fact, where you live determines how long you live. According to the Institute of Medicine, this segregation of opportunity reflects a national pattern. Black and Hispanic children consistently live in neighborhoods with much higher poverty rates than white children. People living in areas with a median income greater than $53,000 per year had a life expectancy almost 14 years longer than that of people living in areas with a median income below $25,000 per year.
There's this food desert, they call it, and it just means that there's not a lot of healthy food. Neighborhood began to respond immediately. We're eating hot chips because that's all you can buy. I mean, if people can't get to a store outside of Harvey, I mean, you got to get a bus, a train, or have a car, and pay all this gas money. The corner store at the other end, I cooked some healthy food and demonstrated it and gave it out to some of the patrons of his store. Now he wants me to come in every month.
Well, price makes a big difference. If you're a person that's on the low income side and you have a small amount with the benefits to feed your family, here in Bronzeville, that could eat up a huge portion of your income as far as food is concerned. And then if you're looking for it to be healthy, then all of your food is gone. So basically, you're forced to be make unhealthy choices for your family because you just don't have the income to support it.
Researcher Adam Drewnowski has shown that healthier food costs more. When faced with a limited budget, people are less able to buy fruit, for example, and other food that is low in calories but have a high nutritional value. Instead, foods that are more affordable, such as sweets and high-fat foods, cost less per calorie but have low nutritional value.
Maryland Manor is outside the Altgeld Gardens, and this is an area where people just come arbitrarily and plod the land and grow their vegetables. Because one of the greatest things saddest things we have in our community is that we don't have a local grocery store. Our organization, PCR, worked with Chicago State University Department of Geography with Daniel Block in doing an assessment to determine what is our food sources in our community. And what the analysis from this report shows that people in my community have to travel 3.5-mile radius in order to find wholesome food stores. So that goes to tell you, which label us one of the worst food desert area within the city of Chicago.
We're standing here at a former Jewel Osco location in the Blue Island at the corner of 127th Burr Oak Avenue and Vincennes near Western Avenue. A little over 2 years ago, Jewel left the Blue Island, moved to a new facility at 119th. This has direct impact on the health in ways that are unexpected. We're used to these large grocery chains being in suburban communities where people get in their cars and drive for their groceries. In a place like Blue Island, this was at people's local grocery store. Jewel had been in Blue Island for 50 years, and people grew up with it and were used to the convenience of having this major chain in our community. They would walk here, they would bike here. There's a Pace bus stop right here on the corner where people could take public transportation and get to Jewel. Without Jewel here, we've lost some options. Smaller local operators noticing the loss of Jewel and moving, and so we hope to work with those corner stores and smaller Hispanic-owned grocery stores, that there's a real opportunity here to serve the community, to feed the community, and by providing more healthy options, make a dramatic impact in the community that they live and work in.
Previous national and local studies indicate that chain supermarkets usually provide the greatest variety of healthy food options that can combine quality and affordable price. However, grocers are not the only thing food deserts lack.
I've been telling folks it's not a food desert, it's an everything desert. And we've been saying all along, people know when you look around a food desert, the only thing that you don't see, it's not like you only don't see grocery stores, you also don't see the access to schools and housing. You don't have the opportunity to be mobile around your own neighborhood, then you really don't have any opportunities.
In July of 2012, the Cook County Place Matters team partnered with the Joint Center for Political and Economic Studies and released a report on health inequalities in Cook County. This report not only gained the support of community leaders, but also got the attention of state public officials.
I want to thank the Joint Center for Political and Economic Studies and the Cook County Place Matters team for all their time and effort on the issues of access to healthy food. You know, I want to say that I'm here not only as county board president, but as a former teacher, a mother, a grandmother, and I know how important access to healthy choices in terms of food are to our families and to our children and to our grandchildren. I'm very grateful for the good work that all of you have done and are doing. You know, there are lots of ways to address the inequalities in this country. My focus as a teacher was always on education and the importance of education in changing lives, but it's equally important that we focus on environmental issues and on health issues. All of these things help address, as I said, the terrible inequality in this country. I'm grateful for your good work. I thank you, and for those of you who are not Chicagoans, welcome you to our city. Thank you.
I first want to thank the Joint Center for this publication, as Lynn, and of course the Cook County team for putting together the data and analysis of things that Dr. Murray said we already know, but we need to repeatedly remind ourselves, and more importantly, remind the public and our neighbors who need to know, and who, in my opinion, as a very recent nonprofit practitioner and community activist and a legislator activist, need to ratchet things up so that we have more transformation in our society that will help us realize an equity agenda that really provides more opportunity in society, especially for poor people.
This reality is why the work of Place Matters is so important. Place Matters works to get at the root of health disparities while recognizing that many of the problems that plague our lowest income residents are intertwined and cannot be addressed singularly. Together, I believe we can work to create an equitable and efficient healthcare system for us, one and all, which everyone from county to county and from coast to coast has access to the quality healthcare that we all deserve. Thank you again to Place Matters for inviting me, and I'm proud to have come from your group. Thank you.
Sociologist Robert Sampson has observed that what is truly American is not so much the individual, but neighborhood inequality. The resources necessary for good health are distributed unequally. This is why place matters for health in Cook County. Bronzeville Alliance leader Angelique Harris was asked about the importance of involving residents in addressing these inequities.
Well, power definitely comes into place, especially with the number of voices that you get together. It does take some strategy, but you know, once you put, you know, names and numbers behind a cause, then they will listen, and we're sure of that.